people are worried that right now they can't be tested because there's not enough tests to go around with the state of Ohio. So it's just with something so new, we just have to kind of be on the waiting game, which is scary, and so that's why we're just telling people, to limit their time going out, not going into big crowds. And I saw last night on the news, there were less people at the basketball games. Usually filled, the Canton Fieldhouse is packed, and unfortunately it was just family, parents and the kids playing. So You're going to see a lot of that happening, and really it's just for the protection because we're not fully sure of how quickly it can. We know it can spread very quickly, and we're just trying to keep it contained to as less people. And again, we may hear more once we get more testing, because more people will be tested then. So
at this time, we don't have enough tests to test all the people.
We don't. There is not enough tests fully in the state of Ohio to test all the people.
So is it a real possibility that more people have this than we even realize, that it's much more widespread than we know right now?
And that could easily be. I don't have the answer to that.
What is the most up-to-date information you have on, how dangerous this is, how prevalent it is in the state and the area, and what people should be doing?
Right. So right now we have 3 confirmed cases, and they were all in Cuyahoga County. We have 15 that are under investigation and 14 that tested negative. And then we have 255 people that have been in surveillance and maybe meet those CDC guidelines that they did travel to one of those places, but they're being under watch. It's been a few months from now, but they're still kind of under investigation, just not following like we are those 15. And so what you have to do is work with your epidemiologist to see those 3 people that were positive in Cuyahoga County, where were they at the last couple of days. So making sure all those places that they have been to, or any people coming in. And so we have not had anything here locally, besides I think a couple weeks ago there was someone that did travel to China, and she self-quarantined herself at her house, and we had constant communication with her on a daily basis. She would do her temperature, let us know how she was feeling, and she did have no symptoms, but we still kind of were following up with her because of her traveling to China.
Well, now, so we've got the 3 confirmed cases. A lot of what people are thinking is that hand washing, things like that, isolating these people is going to be effective. I think what they found out in Seattle was that it was much more contagious than they thought. It was spread like an influenza, where you could just spread it by breathing.
Right.
So, and the incubation period, I think, is pretty long, so you can have this thing without showing any symptoms. So the main problem, as I understand it, is that people have this and are spreading it before they even know they have it.
Right.
So that is how it's spreading so quickly.
And the incubation is 2 to 14 days. So, that is, a lot longer. And again, with us, this being the first time that we've had this coronavirus, we don't really know what's happening in the virus. We don't know, how fast it's moving until it hit here.
What's recommended to people, and who are the people most at risk that should heed these recommendations the most?
Yeah. So we're looking at the elderly, we're looking at people with diabetes, low or immunocompromised. So that's the focus group that we're really focusing on. They haven't seen a lot in kids right now. They haven't, younger adults. And then I know the 3 people that were in Cleveland were in their mid-50s. So you're just, focusing on that group. But the best way is everyone's in connection with each other. So that's why we're just kind of doing a whole mass, more people stay away and in contact with each other.
Well, if I understand it correctly, younger adults and young children, they get it, they contract it, they just don't get sick from it, but they're still able to pass it on.
Right, and that's the thing, it's just like the regular flu, you know what I mean? Sometimes you could be in your house and 2 people get in the house and 2 people don't, it just kind of depends on how your immune system is and if you, can contract it or you don't. So I think that's where we're seeing worrying about that, because sometimes people can pass it without having the symptoms.
Well, that brings me to another point. A lot of people are saying this is like the flu, and we get the flu every year, and thousands of people die from the flu every year, and we don't make a big fuss about it. Is this the same as the flu? Is it more dangerous than the flu? And should we be taking it more seriously than we take the flu?
Right. I think the biggest part of that is because the not knowing how quickly it has been spreading. Because the more you know about something, the more you can, educate the people. So as we're getting the information, we're passing it along, but sometimes it's after the point. because we're, like I said, learning. The virus is moving quickly. It's a new strand that, we don't have we didn't have the testing for, we don't have the vaccine for. So, how do you, it's scary and worrisome for people.
Some people may be thinking they're going to maybe wait it out for a week or two. A vaccine's going to come, or this is all going to blow over very shortly. Is that realistic?
No, and I can't really put a month on it or how many days because we don't know. But no, if people are having the signs, they need to contact their doctor, let them know the symptoms that they're having, and they'll tell them where either to come in or what they'll need, who they'll need to contact, whether to go to the ER or wherever their physician is telling them to go.
Our healthcare system has a certain amount of capacity. We know the amount of patients we expect to see every year. If people do start getting sick, even if it's not life-threatening illnesses, but a lot of these illnesses that are caused by the coronavirus require intensive care, and there's a limited amount of beds for intensive care.
Right.
Does our healthcare system have the capacity for a significant increase in patients should this hit the area?
Yeah, well, I know they're working around the clock. Like I said, here in the Youngstown area, we just have, the Mercy Health affiliates, and I know they are around the clock trying to make sure that we have the best care possible and the biggest capacity that we can do. So it's not just a Mercy Health thing. That's why we're always on, in communication with the governor's office, as well as the Ohio Department of Health, our local health departments, and Mercy Health to all be at the table together to say when it does, if it does hit here, how are we going to help each other out? And so these are things that we're talking about every day. And I'm sure in the next couple of days, things will be coming out on what to do and where to go and this and that. It just it's not definite yet. So that's what we're waiting on, getting all those. And again, we have all these plans, and then it hits, and it's like, oh my God, we got to go right now, So it's just, it's a learning curve for everybody.
For people who want the most updated information, should they regularly check a certain website? Where do they go?
Yeah, so the CDC, if you go, like I said, our health department is through the city of Youngstown. It's right on our website, and it'll give you the direct link to ODH, the coronavirus. There's a 1-800 number. I think it's 1-800 ask for ODH. That'll give you, there's a hotline. Someone's on there from 8 a.m. to 9 p.m. every day answering questions. I know they get hundreds of calls an hour, just people asking questions. So I feel that, that's the best places to go. That's where we're getting our information from because we all want to be on the same page and getting information from the most reliable source, which would be the CDC and then Ohio Department of Health.
BusinessJournalDaily.com. 3 Minutes With is brought to you by...
I want to retire knowing we did it right. We want
to know that it's been worth something.
It's worth everything.
Be intentional about your worth. Farmers National Bank Wealth Management.